Reproductive health is an integral part of healthcare, and healthcare is something that people should have the right to decide for themselves. If Florida Amendment 4 does not pass and access to abortion is denied, women will lose significant control over their bodies. I strongly support Amendment 4, so let's talk about it. Hey everybody, I'm Dr. David Berger, a physician in Florida for over 25 years. I take care of people of all ages, but also all different types of viewpoints, religions, beliefs. And I believe that everyone should have the right to have control over their own bodies and their health care. The government should leave such important decisions to patients and their doctors. That is what medical freedom and liberty is all about. Now, Amendment 4, which is on the ballot and here in Florida, needs 60% in order to pass. Now, currently in the state of Florida, there is an abortion ban after 15 weeks with no exemptions for viability of the fetus. Women and physicians are horrified since the Supreme Court overturned Roe versus Wade. Women are scrambling across state lines to get the type of health care that they need. Since Roe was overturned, infant mortality has increased in this country because women are being forced to carry fetuses that would not survive to term or would not survive soon after being delivered. One such example, which I've talked about before, is my patient Deborah, who has been on the news, who has been on our show, who has talked about and is the horrifying story that she had a fetus that did not have developing kidneys, which therefore did not have the amniotic fluid needed for lungs to develop. She was told that the baby had no chance of survival. Yet because this was determined after 15 weeks, she was not allowed to terminate the pregnancy. Because there was no fluid present in the amniotic fluid, she went through tremendous pain because there was no cushioning, which is one of the things that the amniotic fluid does. She had to take the baby to 37 weeks term, of which at that point she delivered the baby. The baby gasped, turned blue as soon as the baby was delivered, and died in her arms a couple hours later. This was absolutely horrific. Not just for all the pain she went through, not just because she was at risk of potentially not being able to have babies in the future, depending on how this went, but the trauma that she and her family went through to know that there was no way that this was going to be a baby that would make it, and yet she couldn't do anything about it. It was helpless. Brought tremendous amount of anxiety, depression. It was PTSD. And unfortunately, she still suffers because of this to this day. Now, that's just one story of problems, things that can go wrong. There was a woman in Texas who spent 22 days in jail on murder charges after she miscarried but didn't report it because she was afraid that maybe she had done something wrong. The charges were eventually dropped. Doctors are unsure if they can treat ectopic pregnancies. This is when the fetus is developing instead of the uterus, it's developing in the fallopian tube instead. And while that would not lead to a baby being brought to term and being viable, but if the life of the mother was not in imminent harm at that point, she would not be able to terminate that pregnancy. She wouldn't be able to get an abortion. She would have to wait until her life was in imminent danger to do so, when it's much more dangerous and the fetus is much larger to deal with. In those cases, she could potentially lose all of her reproductive organs. Now, that's not just the risk to Florida women and women in general at that exact moment, but there are fewer women now, especially here in the state of Florida, who are going into OBGYNs after medical school for their residency. They're not willing to come here because they can't get the full training that they need to properly take care of women of all of their healthcare issues. They wouldn't be able to get trained on how to perform a safe abortion. That can also lead to less OBGYNs in our state because they're not coming here in the first place. It can lead to less screening for things like cancer, ovarian cancer, uterine cancer, breast cancer. It can also lead to decreased access to birth control, especially for things that are required, that are maybe inserted into a woman's vagina as opposed to just a birth control pill. And unfortunately, we're hearing that could be potentially at risk as well. Now, If Amendment 4 in the state of Florida does pass, then women would be able to terminate a pregnancy up until viability. Viability means at that point, a baby can survive outside of the womb. Now, unlike the propaganda signs that I am seeing on people's lawns here in the state of Florida, it does not allow for late term abortion. The only time that that would happen is if the life of the mother was at risk, or again, if there was a viability that the baby wouldn't survive. But that people are making it seem very false misidentification of the truth that this is allowing for late term abortions. That's just not true. And in fact, I've seen some politicians even state that a termination can happen after the baby is born. What the hell? That is not an abortion. That's murder at that point. You cannot terminate a life once the baby is born alive. Now, granted, such as in the case of my patient, she had to watch her baby die, but it wasn't that the life was terminated. Life terminated because she was not allowed to deal with it beforehand. Now, if the amendment fails, it will immediately go to not just the 15-week abortion ruling that we have now, but it would be prohibited by 6 weeks. Now, at 6 weeks, many people don't even know that they're pregnant. Some people do not have every 4-week cycles. They can have every 8-week cycles, every 6 weeks. Some people only have a period several times a year. People who have things such as polycystic ovaries. Or there could also be teenagers who do not necessarily have started having regular cycles. But if they do have a cycle, they can get pregnant. But they may not know that they skipped a cycle because maybe they weren't ready to have a cycle when it would have normally happened when a woman is older. Now, I totally understand the religious argument for those who believe that life begins at conception. However, I would say to those people, don't terminate your pregnancy if that is against your morals, if that's against your values. But don't put your religious beliefs on other people. Not all religions believe that. In Judaism, we are taught that life begins at breath. It's called the breath of life, that first breath that a baby takes. Up until then, it's not considered a living baby. And of course, there are other religions too, but this denies people of my faith their religious freedom in the name of religious freedom. That seems like hypocrisy to me. Now, already there have been many red states that have found it unconscionable to deny a woman's right over their body. States such as Kansas, Ohio, Montana, North Dakota, Wyoming, they all have passed laws that allow for a pregnancy to be terminated. Now, where it is illegal, like I've talked about, there are women who have died in parking lots because they were denied access into the emergency room because they were told they couldn't have that baby there. Women may not be able to take time off. They may not be able to travel. They may not have the resource, the finances, the support to travel. And they just may not be able to do it, and then they have problems down the line. Now, overall, this amendment needs 60%. It's not a simple majority. Now, this isn't just about women. This is to men out there. This could have an impact on your daughters, your granddaughters, your wives, your nieces. They may have these types of issues. They may want to make decisions for themselves as well. Now, we can make a difference. And if you believe in medical freedom, I would encourage you to vote for Amendment 4. Have a nice day.